Hello, I'm Suyen. I'm Clinical Director of Future Health in SGH, and I oversee innovation and transformation at Sing Health. Thank you very much for joining us today for a very special podcast. Today we have two guests who are absolute stars and legends in the nursing world, and I'll let them introduce themselves.
I'm Terry McDonnell. I have the honor of serving as the Chief Nurse Executive for the Duke University Health System, and I'm also a practicing GI oncology nurse practitioner, which I've been doing for 22 years. It's a pleasure to be here and representing Duke Health and with these very talented women today.
Hi, I'm Tracy, and I'm the Group Chief Nurse for Sing Health. It's great to be here on Suyen's behest.
Well, welcome. Welcome, Terry. This is not your first time in Singapore, is it?
No, it's not. I had the pleasure of coming for the first time in September of this last year. And I love being here, learning from the work that you're all doing and being able to collaborate.
Well, you have an absolutely stellar CV. If you don't mind, I'll just read out a little bit for our audience. So Terry oversees a $1 billion operational budget and a workforce of 8,000 across 3 hospitals, 140 outpatient clinics, and multiple research institutes. How do you do it, Terry? How do you lead and still have your finger on the pulse of what's happening on the ground?
Well, first and foremost, lots of coffee. But I mentioned that I'm still a practicing nurse practitioner. And that is the thing that keeps me grounded and close to the work. By doing that, I still see patients 2 to 3 times a month in the GI oncology clinic. It keeps me understanding how patient flow is working, when things go wrong, what the impacts are. I also spend a lot of time rounding and with our frontline staff and listening to them and understanding their needs and the pebbles in their shoes.
I think that's fantastic. And I mean, if we think back 10, 20, 30 years ago, and I'm going to ask Tracy this next, we once described nursing as an area of work that eats its young, because people come into nursing, they really want to have an impact on the patients and do good things, and sometimes the system just gets the better of them. So I'd like to hear from you and then from Tracy as well. And I've seen that we have made vast improvements. But if you can tell us a little bit about some things that maybe you're personally very passionate about in pushing nursing as an occupation, going beyond just delivering nursing care and how you let your nurses lead.
So we've actually been talking about this a lot in the Duke Health System. We want to see our nurses, so let me take a step back. Traditionally, I think the profession, while we're very trusted, but we've been seen in the light of the compassionate, magical Florence Nightingale with a lantern. And I think in 2025, we need to redefine what nursing is, because we do need to be empathetic clinicians, providers of care, but we also need to understand the economics of care. We need to understand technology, innovation. And I think we're at a very interesting juncture where we've got an opportunity to truly lead the advancement of healthcare delivery in a way that we have not previously.
So nurses are every day, literally at the coalface. If I could hear from you an example of how you have let them lead innovation, because they're the ones who are delivering the care. They ask themselves, if I can quote you, to say, how can I do this better for my patients? And that's where you've done, if I'm not wrong, you've led a huge movement in nursing-led innovation. Can you tell us a little bit more about that?
We call it Empowerment Through Innovation. It's an initiative we launched in the Duke Health System approximately 2 months ago. And what we did is we devised this program. And we've got clings with QR codes all over the hospital, and we also have a SharePoint site. So any nurse, any nursing assistant, any care provider can scan the QR code, and we use a Kaizen methodology. So they go to a landing point where they have to ask 4 questions. They have to answer 4 questions. What is the problem you see? What has been done previously to try and solve it? What do you see as the solution? And finally, what resources do you need? And my goal, you mentioned the size of the workforce. If we can get 1/10 of the workforce identifying problems that we can solve and initiatives that we can launch, imagine the power in that. So far in 2 months, we've received over 100 submissions, and a lot of them have been relatively quick, easy things to fix. But it's really creating that culture of empowerment. See a problem, solve the problem, because the people, to your point, closest to the work are the ones who are best equipped to really bring the solutions forward.
I agree, totally. Tracy, you have smashed a lot of walls and pushed a lot of boundaries in nursing in Singapore. Can you tell us about some of the things maybe you feel are most impactful or that you're most proud of?
Okay, so I'll take many steps back, right? I joined nursing 38 years ago, 39 to be exact this year. And I've seen how nursing has changed over the years, right? I grew up in a system where we came from an apprenticeship model largely. We had what you call nurses eating the young. And I would remember my supervisors would be screaming at me from one end of the hall to the other, right? And that was something that we had changed over time. So now if you look at my nursing leaders, they are all nurturing, empowering. We are all practicing open door policy and all that. So over the years, we have sort of transformed the way they think, the way they want to act. We encourage leadership. And so we were traditionally known as clinical nurses with some management component and some education component. Over the years, we have added in career paths to grow nurses in innovation, to grow nurses in research, to grow nurses in informatics, besides clinical, growing APNs, educators, as well as the leaders, the managers. And that sort of helped us set that first stage towards empowering our nurses. Over time, our nurses are very good at process improvements. They love quality improvement, right? And so they do a lot at the ground level, at the bedside, because they see the issues. We have introduced Kaizen boards, we have introduced synergy boards, we have introduced GROS for them to identify issues as they see it and they solve it. And we sort of empower them. When you need help, you come to us. You need budget, you come to us. But otherwise, you are able to be empowered and to solve things on your own because you are there with the patients. You know the problems, you know the solutions. I think what I'm most proud of is seeing how my nurses have grown to be more confident thinkers. They don't just take instructions, they lead. They are not afraid to give their 2 cents worth. They are not afraid to contribute to a multi-D team. And they are opinion leaders. And I'm very proud that SingHealth nurses are opinion leaders in their area of practice, nationally, some internationally. And that's why we want to grow. A lot how we are seeing nursing transform, and Terry and I have this conversation often, right? We are being pressured by external factors as well. Healthcare has transformed. There's no way. You know, in SingHealth, we are building new infrastructure. It's very easy to build buildings. It's not easy to staff those buildings with good staff. And so there's that whole thing about optimizing what you have, setting the right people with the right skills in the right place. And that involves a lot of change management. It involves a lot of thinking behind. And that's where we are both very passionate about leading innovation, because that's the only way we can augment what our nurses do so that our nurses can practice at a higher skill set, higher competence, but yet augmented by technology, by AI, by whatever it is.
I do want to address the issue of burnout and attrition, which I think it's very real. Can you tell us a little bit more about what you think really makes a difference to our nursing workforce, how we can retain talent better? And then I'm going to ask you about your experience, because I know that you've done great work as well and brought the attrition rate down quite tremendously. I'll start with you.
Sure. So for the longest time, I would say Sing Health has an attrition rate about average 6%. It was only during COVID-19 and honestly when COVID first hit our shores, right, in 2022, I had 0.5% resignation rate, which was unbelievable, right, in the face of history. Then it started going up, right, because of various factors. It has now come to even better than pre-COVID levels. So now we are about 5% average. And I would say among the clusters, we are the best with the attrition rate. And retention is not just a single factor, it's multifactorial. So it's about empowerment, it's about professional development, it's about how your supervisors treat your staff, how your staff are empowered to be able to speak up. It's that whole range of things. If they feel that they come to work and there's meaning in their work, and they have great supervisors, great peers, great other members of the healthcare team, they'll want to come to work and they'll want to stay here. And I think Sing Health has provided quite a bit of factors or opportunities that they somehow don't find outside. And I pride myself and my team that nurses who left come back, right? Yeah. So it's multifactorial, but it needs everybody's on deck with the same mindset and the same principles in mind.
That similar approach that you took?
There's some subtle nuances, I think, that impacted the American healthcare system a little bit differently. And I think it's cultural. So our normal attrition rate is sadly much higher than yours. I would say that pre-COVID, we were probably looking at about 12, 13%, and that was considered healthy. And through the arc of COVID hit our shores in 2020. And through that entire arc, we saw a lot of nurses leave to go and do travel assignments. They could make double their base pay by going and doing gig work in other hospitals. At the same time, we also saw fatigue in an aging workforce. So we saw a lot of retirements, a lot of people leave the profession, and in 2022, our attrition rate was up to, I think it was 22.5 or 25%. It was quite high. It was in the 20s. And, you know, we have now a very young nursing workforce. We leveraged new graduates. Yet the turnover in the first 3 years of an average American nurse, that rate is still up around 25%, despite our regular overall attrition rate coming back to about 14.9%. So we did a lot of soul searching, and what we found, you know, you used the term burnout. When we dug in, it was anxiety, fear. They didn't feel equipped. They didn't feel like they understood the work, that they were completely prepared for the work. And unfortunately, through the course of COVID, we had centralized a lot of things, education, onboarding. So we had an entire workforce of new nurses who felt ill-prepared. We shifted all of that. We brought all of the education, the support, back to the bedside, to their elbows, and that's what really made a difference. So now we're creating that sense of belonging. I mean, our belonging scores are higher than they've ever been, and we're gaining momentum. But it took that shift in really making sure that they felt comfortable and confident in the work.
If I may pivot to something a little bit more personal. Sure. And you're both mothers. And you, if I'm not wrong, you both have daughters. And I think it is so important for them to see you leading in your profession. Is there anything that you would say to your younger self? Because we always have the benefit of hindsight. And to your daughter's generation, an important message that you would like to impart from your journey? Because we've all had very varied journeys, you know, over the years. If it's not too personal, if that's okay.
I will share that my daughter is entering her second year as a pediatric resident in the United States. So at some point, her nurse mother gave the message that, you know, if she really wanted to go deeply into medicine, she chose her path. What I would tell her and what I've encouraged her to do along the way is to not be afraid to use her voice. I think when I started my career, and this is a second career for me, so I'm 22 years into this, when I started my career, I overthought a lot of things. And, you know, I would think about how is what I'm going to say land? What's the impact going to be? Are there going to be consequences? Now in 2025, I think I'm far more equipped to use my voice, and I encourage my daughter to use her voice much sooner in her career than I think I did.
I love that.
My daughter comes from that Gen X, right? And I think when I was younger, I'm an introvert.
We all are. We agreed on that.
And I don't go out of my way to find opportunities for myself, right? I try, and like Terry, right? I worry about what people will say, what people will think. If I should ask this question, will I be looking stupid, etc., etc. And I think I instilled that in her, that now she's the complete opposite of me. She's a social butterfly. She's not afraid to speak her mind. She's not afraid. And I suppose it's a generational thing as well, but she's not afraid to go for opportunities. And I always encourage her in that don't, and I encourage my younger nurses the same way, right? Yeah. That don't wait for opportunities to land in your lap. Nothing will land in your lap unless you seek it out yourself. Your career is your own career. You need to go and fight for it and do what you like the most. So she's the opposite of me. She's extroverted. She wants to do what she wants to do. So I think that rubs her, because she saw probably the negative side of me in terms of the introvertedness, and so she has pivoted to the other way. So when she was growing up, she wanted to be a doctor, and I think a lot of you know that she wanted to be a doctor. She is now looking at me. No, I'm not going to work so hard as you. I'm going to be a lawyer.
We need good lawyers, and I will support her in that. I will absolutely support her in that. But it's about, we used to say, I want to ask for my seat at the table, which we were afraid of before, right? We tended to sit back. And I think it should also progress to, if you don't give me the seat at the table, I'll make my own table, and I love that. I mean, not just for the girls, I mean, for the younger generation, and which is why we really want to hear your stories, because we feel that your journey and what you've gleaned from it and what you pass on to the next generation of nurses and all the medical staff is so important. We don't want to lose that. If you don't mind, I just want to read something about you. I do some homework, which I thought was very powerful. If you don't mind, I'll read it out. People ask me about career strategy or confidence or how I knew. I didn't. I just stayed in the hard rooms as I figured it out. And I listened to the part of me that couldn't not care. And I absolutely love that. And I think that really embodies what I've known of you as well, Tracy. It's that willingness to sort of dig in your heels and say, I don't run away from the problems. I run towards the problem, and I'm going to be part of the solution. And I think it's a powerful story as well that you've told previously about your journey towards nursing. You didn't start out in it, right from the beginning. And how do you impart this? Because you have so many staff, right? How do you not lose that personal touch? Because we want you to inspire future generations. What opportunities do you create, for the younger ones to mentor, to nurture them?
We're continually trying to build new programs to encourage them to pursue continuing education or changing models of care, whatever it is that brings them joy. So a few things. We've launched a couple of different programs. We've got a hackathon format where if teams want to come together with ideas and create a business plan and a project, we'll fund them. You know, we do a lot of leadership development programming, mentorship. I have a policy where if anybody wants to reach out to me by email, then they get time on my calendar. The door is open, and I've had a lot of frontline nurses take me up on that, which is phenomenal. You know, I think one of the things that we need to do is cultivate the next generation. Because it isn't just about us and our careers, it's about the legacy we leave behind and the people we've grown and developed.
And for you?
The same. We have created all these different programs, right? Whether it's leadership training for the young, whether it's mentorship. I think it's creating that comfort on the person's part to be able to approach you. And so we have always practiced this open door. When I meet new nurses, I tell them what I stand for. And I tell them that whatever it is, you can come to me and you can come to any chief nurses in the cluster, right? That is one of the reasons why I asked to form a nursing student council.
Yes.
Because the nursing students are our future.
Yes.
Traditionally, we sponsor nursing students. They are in school for 3 years or 4 years, and we don't see them until they come out. And so they don't embody the values that we have. They don't know us as a person or employer or an organization. And what the Nursing Student Council, so this is purely led by nursing students of different years from different schools, who will then go out and mentor other nursing students. We bring them back for events, we bring them back for tutorials, we engage with them. It's a way for us to tell them that your voices are still heard. You have a means to us. We create that environment for you. And I would say that has changed that whole perception of nursing students. In fact, earlier I was with Anne, and Anne is from the School of Nursing. And I brought her, I wanted her to give a pep talk as well to my nursing students, right? The Nursing Student Council. And the chair of the Nursing Student Council was sharing how nursing students are invisible carers, that people don't see them as equal players at the table, but yet they have so much to contribute in their own ways. And how do we then get them to be seen as important players, albeit they are not trained nurses, there's limit to what they can practice, but yet they can do their special things, right? And that was so powerful. And I want that to be translated to the other nursing students, because they are our future generation. And they will grow up thinking that way, then that whole culture will shift, right? As we embody how they think and how they feel. Because honestly, having a Gen X, Gen Z in my house, the way of communicating, the way of thinking, the way of behaving is totally different from how we interact, right? And so we need to be able to learn their language and their way of working in order to build closer relationships.
And because it's such a wide spectrum of workforce that you look after, and we talked about the younger ones, the young graduates and the nursing students, or we also have the older nurses. How do we help them maintain their relevance and their joy at work and their job satisfaction?
Actually, the older ones are the ones that are most satisfied.
Okay.
And that has been consistently shown, right? Once they hit 10 years, they are the most satisfied group. They are happy, they find meaning. It's the younger ones that we need to be able to nurture them. And that whole thing about flexible work arrangements, about how to enable them to have a healthy family life, to be able to go off on maternity, whatever, but yet be able to contribute to work. Now what I'm grappling is, in Sing Health, I have 5 generations of nurses, all the way from baby boomers to Gen Z. And my Gen Z tells me the Gen Alpha that's coming out in 2 years' time is even worse than Gen Z. And so I'll have 6 generations in 2 years' time. And they all think differently, they communicate differently. So the biggest challenge right now is how to have our nursing supervisors, who are the millennials and the Gen X, manage nurses and young graduates and student nurses who are of the Gen Z, right? And how do they then bridge that gap? that is a work in progress. So we run a lot of programs, we run communication courses, we run leadership courses for new leaders in order for them to see the other person's point of view, and also for the young to see their point of view. Each of them come to work with good intentions. They want to do good. But it's the way how they interact with each other that sometimes is bumpy.
Is that your similar experience?
Yes, it absolutely is. And that was one of the things that we've been talking about is how do you meet all of the communication needs of 5, soon 6 generations of workforce? And how do you meet also their expectations of the job? You know, workforce management is becoming incredibly complex because one generation wants 312s. Again, I'll refer to the American framework. Yet another generation, they want to be able to mix it up. They want a couple 8s, they want some 4s. And how do we bring all of that together? And that's where we're leveraging technology. But these are fascinating times.
Yes, yes. While we've made a lot of progress, I'm sure there are barriers and gaps that still exist to where you would like nursing to be. So can you share with us, what are some things that you would like to realize in the next, 5 years or so? And what are the things that we need to overcome? Maybe we can problem solve it together.
One thing I would love to see is for us to really think critically about the scope of practice for nursing. Not just advanced practice nurses, but what really, we're seeing a phenomenon globally where there's going to be less physicians, less nurses. And how do we really make sure that everyone can truly practice at the top of their scope and license as the demands are increasing? And I think we need to think differently about the team construct and what the skills are of everyone who's part of that team so we optimize. And I think there could come tremendous professional gratification if we were to start really thinking about the capabilities of each member of that team. I would love to see us revisit scope of practice of nursing and expand it.
Okay. So, things like nurse-led facilities, for example, are par for the course. And maybe that's something that we would eventually develop here.
We already have nurse-led services,
Yes.
right? So the 2 biggest things that will be occupying most of my time in the next 5 years is how do we use technology to augment our care?
Yes.
And how do we optimize our nursing workforce? And because you're a group director for innovation, we have been doing bits and pieces of innovation, right? So part of that innovation is to augment our work. Another part is actually to remove some of the admin burden, which quite successful, certain things that we have put in place. The third one is how do we empower our patients and caregivers?
Yes. Yeah.
And that empowerment of patients and caregivers through technology and digitalization, we've introduced a bedside iPad, was meant to empower them so that it releases the load of the nurses in terms of basic care, but it helps them to transit better to the community. That is something that we need to do, not only at SingHealth level, but at national level. Because I think over time, our patients and caregivers put everything onto the nurse.
Yes.
Such that it doesn't help them, it doesn't help us. Right? In fact, a group of nurses from another country was asking me, why is it that your nurses are doing A to Z? Our nurses only do certain things. But that's the reality in Singapore, right? And that's something that we need to change. My hope is that all the POCs and POVs that we are currently doing will come together as one whole in order to influence my nurse to patient ratio. Currently it can't because we are all in pockets. But unless everything comes into one big circle and one big complete piece, then I can say, there's technology fully to augment my nurse role. I can reduce the number of nurses in this area of practice, so that I can stretch my nurses to other places.
Where they're
And
much better utilized, right?
And enable them to practice at a top license. I think we have progressively over the years also moved our nurses out from certain settings where it is purely transactional. It doesn't make use of their full scope of practice. because that work can be taken by other people. So it's not so much of touch shifting. You know, I'm against doctors touch shifting to us.
I hear her loud and clear.
But I also don't want to touch shift to other groups of people, right? But it's about right sighting of skill sets. The other part of optimization is how do we bring in our ancillary group to help us with some of the work. And that is my biggest challenge because we are constrained by the number of locals who want to join us in the ancillary group. We are constrained by the number that we can recruit from overseas, right? Because of work permit quotas. But as long as we don't have that group to take on some of the basic role, my nurses will never be able to practice at the top of their license, in the inpatient wards especially. And so how do we change that to have an optimal number? I still need to think about the new infra that's coming, your elective care center, phase 2 SGH, EGH, ECH that are coming on board. And we need a way of optimizing in the next 5 years so that I'll have enough people that can staff all these areas.
And change management is not the easiest. And I want to ask you about your philosophy of innovation. How do we make it work? Or how do we move from, again, like pilots, it's a good idea, just test it, to actually letting it permeate the entire nursing ecosystem? Maybe also about culture, you know, how do we, if we would ask you, how do you build an innovation culture or an improvement culture? What would you share with us?
I would say the thing that we have found most helpful is when we engage the staff in developing the solutions and in being early adopters. So it's fascinating. We've been working on ambient voice recognition documentation for nursing. It's been tremendously successful for clinicians, nurse practitioners, doctors, but the nursing piece isn't quite there yet. So we're continuing to work on that. And rather than a company coming in and just trying to disseminate it, we've got a whole group of nurses that are working to figure out how to make it work for nursing. You know, as we're looking at changing all of these things, bringing in computer vision, we're actually about to open 3 innovation units as we retrofit old floors in our university hospital. We've got 99 beds, and we've got technology partners that are partnering with us, but we've got nurses in the implementation team, in the design team, to help us figure out how to operationalize it. And it's interesting, when a nurse adopts something and there's buy-in, then suddenly everyone's open to it because they understand it. They worked with us. I think the thing that we're battling right now with adoption of technology is fear of the unknown. There's this narrative that, you know, the nurse bots are going to take over the world. Well, they're not. But we need to change that narrative by bringing them into the development.
And this, someone or other will always surface the concern that, oh, if you're going towards technology and digital, we lose the human touch. But I think we really have emphasized that no, what we want is we want the humans to be delivering the human touch. The roles that can be taken by technology and digitalization and, you know, the bots, and that's where that would make the most sense. Has that been your experience as well, that people do express that fear, but you're able to orchestrate it such that, you know, those who need that hand and that time by the bedside, you know, for example, get that?
Absolutely. I mean, when we start to dig into the complaints, it's about not having enough time with the patient. All of this technology, as Tracy said, is going to free up the precious resource of human care that we have to be at the bedside, doing the work that we've all been drawn to do. That's what fills our cup, and that's how technology can help us.
Yeah, so it's the same narrative, right? I tell this to all our new nurses, I tell it to our existing nurses, that we are now not able to do the full scope of what we need to do. So there, and I'm not afraid to say this, there are missed care, right? We did a study, there are missed care. And the miscare is not because we are not competent, because we are not doing our work or whatever. The miscare is because we didn't have the time. So one of the biggest miscare is education. Talking to patients, explaining things. The convenient one is, I'll ask somebody else to attend to you. Right? If we have technology that augments us, that augments our work, that augments our decision making, the nurses will have more time to actually deliver what they need to do. But the narrative that we have been doing is that, so there was a bit of fear that AI is going to take over.
Yeah.
So as we talk a lot about AI and AI algorithms and all that, and when I hold retreats, the nurses would ask me, are we going to be replaced by AI? When you introduce all this tech, are we going to be replaced? And the answer is no. So the narrative has always been, you'll never be replaced, but it will help you to do your work better.
Yeah.
AI will help you to think better,
Yeah.
to make better decisions, but it will never replace you as a human in that care. We came in because of that human touch, right?
But we also want to ensure that our staff are comfortable and they know what to do with, right? So it's about the AI guardrails and their understanding.
Balance, right? Yeah.
Yeah. As we wrap up the session, is there anything you would like to say, your wish list for nursing and for the healthcare system in general?
Oh, you ask the easy questions, don't you? You know, the last 2 days have been absolutely phenomenal.
Yeah.
And my wish, my hope, my dream is that these type of conversations where we come together from the United States and Singapore and we share our common issues, but also problem solve together. I want to see more of that, not less. And I think right now, you know, there's such an instinct to just sit in our silos and work on our own problems because of the intensity. But we're so much more effective when we can do it together, and I would love to see more of that.
We would definitely have more of that. Tracy, I always give you the last word.
So Terry and I recognize this, right? That we have actually more similarities than differences. And a lot of things that they want to do, we also thinking the same things, right? So definitely that cross-sharing is very important. And we already agreed we are going to work on certain things for nursing. My wish is that my nurses will be happy, will find meaning in their work, will be empowered to deliver the care that they need to deliver.
And we are so lucky to have both of you. Thank you very much for your leadership and for your vision for nursing and for pushing all those boundaries. Thank you for coming out of your introvert self, both of you, to do this session today. So please do join me in thanking Terry and Tracy for a wonderful session today.
Thank you so much, Suyan.
Thank you. It's been a pleasure.
Thank you.